Welcome to the Herbal Extract Company's Practitioner Education Series. I'm Lara Ryan, and today's conversation will focus on naturopathic understanding of kidney health and some herbal medicine approaches to supporting kidney disease. We're joined today by Adrian Harper from his clinic in Melbourne. Adrian is a naturopath, a herbalist and a nutritionist with 14 years of clinical naturopathy experience, where he's been working primarily in integrative medicine and collaborative care settings. And this is really due to the unique patients that Adrian attracts. So Adrian, I'm so pleased that you are here with us today. It's great to have you chatting with us and sharing all of your wisdom with us. Welcome.
Right. Good to be able to join you today.
So Adrian, your practice down in Melbourne, it's got a focus on complex illness. So my understanding is you're seeing patients with mold biotoxin illness, which we also know as chronic inflammatory response syndrome. You work with people who are experiencing chronic kidney disease and renal failure. And you've also got a broad spectrum across chronic infections, immune disorders, and then gut microbiome and digestive health.
Yeah, that's primarily my patient base, and I'd say the majority of the patients I see either have mold-related illness or kind of like fatigue syndromes, and then the other half tend to be chronic kidney disease, and then particularly around like gut health plays such an important role in both those kind of patient sets. So that's, I guess, another focus for me.
Yeah, look, really interesting client base, and we really wanted to share this time with you for a few reasons. Here at the Herbal Extract Company, for one, we've been doing a deep dive this year really into the herbs in our dispensary that support kidney health. We've recently just published the Naturopathic Guide to Kidney Disease, which has been written by Christine Thomas, and people can grab that from our website and download it if they need it. But the reason we really wanted to get you on board is we really feel that in our naturopathic practices, we're maybe not giving kidney disease or kidney health or kidney function the credit or the attention that it deserves. I think as practitioners, we're really great at being aware of liver health, of gut health, of adrenal health. And then I even think we go on to talk a lot about detoxification. And we're great at making sure all of these organs of elimination are open and working. But we maybe forget that the kidneys are a really vital component of that whole system and of that whole system working really well. So I'm so glad that you're here today. And I guess I just want to kick off with, why are people coming to you? Why are people seeking you out as their practitioner, and how do they arrive in your clinic, and what are you seeing?
So particularly, I guess, in terms of chronic kidney disease, I'm seeing a range of different kidney diseases. I'm seeing people that are at various levels and stages of kidney function. In terms of why patients are generally seeking me out, I would say that's primarily because they see a nephrologist and get a diagnosis, and then there's very little intervention. Normally they're told that there's not much that they can do, they just need to monitor. And then the end result will likely be dialysis or a transplant at some stage. So people are definitely looking for alternative kind of like approaches, I guess more of a preventative care approach, which isn't really being kind of offered by the mainstream medical system at this stage. It's really, and then patients looking out for practitioners that work with kidney disease, and there's very few practitioners that I would say are kind of niching in kidney disease in Australia, and so that also leads them to me as well.
They're very lucky to find you. And look, I heard you say just then, when we get into that chronic disease state, it can lead to dialysis, it can lead to, we're talking about quite serious health conditions here. And I know for someone like me, who is not a practitioner that deals with chronic kidney disease, it can be a bit frightening. It can be a bit confronting. It's something that I would probably think, that's not my area, I want to refer on. Should we be afraid of working with kidneys, or is there actually room for us to work and to do some good stuff with our patients?
I think, like the fear kind of often, comes from a lack of understanding. And if you look back at a lot of the naturopathy courses, I know like my naturopathy course that I did, when we had the week of kidneys, we talked a bit about kidney stones and urinary tract infections, and then got told not to treat anything else because it's too complicated. And I know some of the main naturopathic textbooks also have that message as well. So I think that does reduce confidence in the practitioner that they don't have that kind of foundational education around kidneys. And really, like, kidney disease is rising in Australia and across the world. It's one of the leading causes of death. And so it's something that we really need to be on top of as practitioners, particularly if you're detecting it at early stages. There's so much that can be done around kind of preventative care and kind of removing that chance that someone's going to be ending up on dialysis or needing a transplant.
Yeah, again, so important that we raise some awareness and that we know what we're looking for as practitioners.
Exactly.
Now, I know you've come to this very unique pathway and unique specialty in natural health through your own journey. Are you happy to share a little bit of your own background and your own experience in this area?
Yeah, definitely. So I was diagnosed with a genetic kidney condition called renal tubular acidosis, which is fairly rare. When I was 15 years old, it kind of caused my kidneys to kind of like form stones. And so I had my first kidney stone at 15 and had to have an lithotripsy to remove the stone. And then I saw a specialist in around that time. I saw dietitians. There really wasn't a lot of interventions that they recommended. Besides, the only thing my specialist put me on was potassium citrate. Beyond that, there wasn't really any kind of recommendations around what type of diet would be helpful, other things I could potentially do to kind of like support my kind of kidney health. So that was kind of like when I started to read like books, particularly around complementary care and nutrition. I decided to study naturopathy.
I think that's a great way to, sounds like you've been shot out of a cannon into naturopathy with a journey like that. But what a fantastic way for you to have that compassion and understanding for your patients. It's a bit of a special bond to share with them along the way. So when a patient comes to see you, maybe give us a bit of background of maybe the types of kidney dysfunction that you're seeing, maybe what stages that your patient is at and where you're able to intervene in those stages. I'd love to know sort of how they appear in your clinic and where you start.
So I see a wide range of different kidney conditions. So I see a lot of patients that have kidney kind of like decline due to metabolic syndrome, kind of like related kind of conditions, particularly things like diabetes, hypertension, but also a range of other chronic kidney illnesses like IgA nephropathy, polycystic kidney disease, lupus nephritis, and then things like nephrotic syndrome as well. In terms of the stage that patients approach me, generally it can be from very early kind of like diagnosis where there's very little or no loss of kidney function, to patients that are trying to avoid or delay dialysis, or otherwise also patients that are on dialysis and transplant patients as well.
And how do you choose where to start? How do you introduce how you're going to work with them with natural medicine?
So particularly like early stage kidney disease, a lot of the focus is on getting the diet right, particularly getting a correct diet for kidney disease over the long term is quite integral for correcting things like acid-base balance and kind of like preventing kind of like further decline of the function. Looking at treatments that help support kind of circulation through the kidneys, reduce inflammation and kind of fibrosis and sclerosis through the kidneys, kind of like long term, are really good ways to support function as well. But then I see a lot of patients that are either stage 4 or stage 5 kidney disease, really quite close to needing dialysis. And they're the patients that are often kind of most motivated to really jump right into support. And there's, such a small space of time in that context to really be looking at all the ways that you can kind of support things kind of like straight up, essentially.
Goodness, you really are at the coalface with it here, aren't you? But I guess what I am really hearing though is, even with the extent of your experience, I'm really hearing you wanting to do that whole patient support and how that's sort of the foundation of those treatment plans. And you have just touched on a little bit that there's other body systems involved. You know, you talked about the metabolic health and how there's other things that are starting to deteriorate and fall apart that need attention in conjunction with looking after kidneys.
So in terms of kind of other systems, definitely in the earlier stages, I'm looking particularly at kind of gut microbiome health as well. There's a lot of research that kind of indicates a lot of inflammatory metabolites that are kind of produced by dysbiotic gut bacteria that then kind of drive kidney inflammation. And it's something that I've seen in clinical practice, correcting kind of opportunistic bacteria that kind of like drive that inflammation can actually see improvements with kidney function as well. So that's definitely a big focus. At the later stages of chronic kidney disease, looking at kind of cardiovascular health is really integral, particularly when kidney function is dropping. There's a lot of pressure that's put on the heart and the circulatory system. And then they also can like feed back onto the kidney health as well. So that's always something that I'm looking at supporting as well. Things like liver health and even kind of going back to gut health, particularly in those later stages of kind of kidney failure. You'll find that really supporting bowel clearance can kind of improve outcomes as well. A lot of uremic waste and other kind of toxins that build up with low kidney function can be cleared by the bowel as well. So really ensuring that kind of bowel motility and clearance is really working well. And particularly there's a number of research studies that show that patients that have constipation with renal failure have kind of like worse outcomes than patients that have kind of like regular bowel motion. So that's really something that's integral to get right at those later stages of kidney disease.
You know, what I'm sort of taking from that is very much that you're saying let's give the kidneys as much of a break as possible to heal and really pick up their job with the other organs of elimination. What would, when I've heard you now mention cardiovascular, the metabolic, all the other things that go in, if we say for us practitioners with an untrained kidney eye, is there anything that we would be looking for clinically? Say a patient came to us that maybe kidney wasn't their first problem. They had come because of a metabolic problem. They had come because there'd been some changes in their pathology. What sort of things should we be looking for in an untrained eye that might make us zero in and go, oh, I really should be doing some support and preventative healthcare with the kidneys here?
So I would say that any patient that's got diabetes or blood sugar dysregulation, hypertension or hypercholesterolemia, really you should be looking at kind of supporting kidney health as well, because all those conditions will kind of like drive kind of kidney dysfunction and kind of like put further pressure on particularly the circulation through the kidneys. And so it's pretty common to see those things hand in hand, and particularly I see quite a lot of older patients that have these types of presentations, and also got to be quite cautious around what types of pharmaceuticals they've been put on, because some can also kind of like stress the kidneys, even though they might be alleviating the original reason why they were prescribed. So definitely from that perspective, really kind of correcting those kind of other areas whilst you're also trying to support the kidneys, protect the kidneys is really important.
That's good. That's what we need to know. Where can we see it? And even if we end up referring to you, it's good for us to be able to acknowledge and pick it up and be aware of, you know, the kidneys needing some attention and a little bit of love from us.
Yeah, and particularly in terms of those like metabolic kind of presentations, I think a lot of naturopaths are right on top of managing things like blood glucose and hypertension. And really, if you're kind of supporting those areas, you're going to get some, improvement with the kidney health as well. So you don't necessarily need to be directly treating the kidney as such to be kind of getting improvements as well for some of these conditions.
I know your background is you've worked clinically in integrative medicine fields. How do you find working? I imagine once you get to sort of, you know, the chronic kidney disease end, you're working a lot with specialists, with doctors. having a bit of a network system going on. How do you find working with those other healthcare professionals or with allied healthcare professionals? And is there any advice for the rest of us that are doing so about the best way to work in an integrated way with other professionals?
I think particularly with nephrologists, it can be quite challenging. There's varying understandings of complementary medicine with kind of kidney health with nephrologists. So I find that nephrologists definitely are becoming more open to diet interventions and supplement support, but there's definitely a range of specialists that are still not open and will advise patients not to take any supplements. I guess generally in terms of specialists, particularly with herbal medicine, they're like overly cautious. So I still think it's really important in terms of communicating with nephrologists, and a lot of nephrologists, if you're managing the patient well, will not be that interested in what you're doing, but they'll often tell their patients to keep what they're doing going because it's obviously working. In terms of allied health, I find particularly pharmacists really useful to collaborate with, particularly where there's patients with a lot of medications going on. They may not have actually had that combination of medications reviewed. And also pharmacists are normally very open to kind of discussing supplements, including herbal medicines and possible reactions as well.
That's a really good tip and I think it is one of those things, as much as we do love and we know the effectiveness of our own herbs and complementary medicines, they are medicines. They have that pharmacological effect. And as much as we're very pro, we do have to also be very aware, particularly when there is that cocktail of medications. Okay, so given we've got this really complex and also holistic nature of how you're working with your patients, and obviously I want to get to talking about the herbs because that's my favourite bit, and we'll get there in a minute. But how do you go about putting a treatment plan together? Where does that start? And then we'll be able to jump into some good herbs to support this.
So I find it really important to get the diet right with patients first. Most of my patients I will be putting on some type of kind of alkaline diet that's focused more on kind of emphasizing plant-based proteins, and that will kind of like depend on their stage of kidney disease, what they need to do around that specifically. But I do find getting the diet, particularly for long-term outcomes, is really integral. And then also just making sure that patients have kind of good lifestyle practices, such as doing kind of exercise, not smoking or drinking, and particularly looking at their environment as well, because I have found there's some kidney conditions that can be exacerbated by kind of exposure to things like allergens, pollen, dust and mold. And also a number of mycotoxins will also have kind of nephrotoxic effects as well. So you just want to make sure that they're in a really healthy environment. Then normally looking at kind of like base supplements that help protect the kidney and also support circulation, and definitely basic things like CoQ10 and kind of like fish oils are a really good option, I find, for most patients. They're extremely safe. They're also supplements that specialists will generally be happy for their patients to be taking, and they have kind of other flow-on effects, particularly around things like cardiovascular health as well. Then once we've got those base foundations set up, that's when we start to look more at kind of modulating things further with herbal medicine, particularly in early stages where we might be looking at gut health. We might look at doing kind of microbiome sequencing and then using herbs in that context to correct kind of gut microbiome kind of imbalances. Anything that kind of encourages sweating can be quite helpful in terms of kind of clearing things like urea, excess potassium via the skin. So things like infrared saunas, baths that encourage sweating, or otherwise kind of exercise, if they're capable, that kind of encourages some sweating, can also be helpful. And like one of the key things is when there's compromised kidney function is that you want to be really focusing on supporting other channels of elimination. So primarily that's going to be the bowels, the skin and the lungs as well.
Now, as I said, I'm eager to talk to you about herbs because I know that you make up some amazing formulas and mixes that are really effective. So tell us a little bit. So we've got a good nutritional foundation now. You've covered the lifestyle basics. We've talked about detox and elimination. What are your standout herbs? What are some of your favourites, and how are you approaching it? What things are you trying to target and cover when you're building a formula for someone?
Yeah, that's a really difficult question because it's so varied depending on the kidney condition and the stage of kidney disease and just the patient's kind of other unique presentations. But I guess in terms of herbs, I like to think of them more in kind of actions around the kidney. So there's definitely a number of herbs that are kind of like considered to be kind of like either tropho-restorative or tonics to the kidneys. A lot of the evidence to support this is out of China. So a lot of the herbs that have these kind of tropho-restorative effects tend to be more of the herbs from the Chinese medicine materia medica. So definitely things like astragalus is one that I would always think of. You can go quite high dose with it. It's supportive to the kidneys, but also supportive to things like the adrenals and the heart, and particularly where there's hypertension, I find it helpful as well. Other tonic herbs, cordyceps would be another one that I use fairly frequently, and there's fairly good amount of research that supports kind of improving kidney parameters with the use of cordyceps, but then it's also got kind of those adaptogen and immune supporting effects. As well, another mushroom that's got some good kind of data on it for kidney disease as well is reishi mushroom. So reishi is definitely a herb that I use quite frequently. It also can improve insulin sensitivity, so that's quite helpful where you go to presentation of kind of diabetes and kidney disease. But it also has inhibiting effects as well, so potentially kind of useful in hypertension. There's also some research around it suggesting that it may kind of like retard the growth of cysts in polycystic kidney disease. So
I didn't realise that reishi actually had so many clinical applications to do with kidney and just as a tonic in general. It sounds like a great herb to get on board.
I like it because it's it has multiple actions, particularly like just has general tonic for supporting kind of immune system as well, which is often low in a lot of kidney disease, and then it's got really a high safety profile as well. So it's a great herb to be kind of working with in kidney disease.
What other actions are we trying to do? Do we need to work with infection? Are we working with restoring endothelial function? What other actions are you sort of bringing in when you're looking at a real holistic formula for someone?
Yeah, so definitely looking at herbs that help support endothelial function and circulation, microcirculation, I find really important. Definitely things like ginkgo I use a lot of, and ginkgo has also been shown to help kind of like reduce scarring in the kidneys as well. So that's often kind of like one of the first herbs I would think of in that context. Also, dong quai. It's very good for helping kind of support circulation. It's often prescribed in that manner from a TCM perspective, but it also helps in terms of kind of like some of the other areas in renal failure, particularly. It can help with the production of erythropoietin, which is often impaired with lower kidney function. Can also help to mobilise iron from the spleen and liver, and so that can help with kind of increased iron, where you're often seeing anemia or kind of increased iron kind of needs with low kidney function. But then it also has that kind of like protective effect from kind of inflammation as well. So it's probably not a herb that people think of first up in regards to kidney disease, but it's definitely one that's got a number of kind of like benefits, and particularly there's some research out of China combining dong quai and astragalus to kind of show that it kind of improves kind of ischemic kind of microvasculature and renal interstitial fibrosis as well. So it's definitely a good option to kind of consider. Other herbs I can like often use is perilla for kind of anti-inflammatory, anti-allergic effects. Particularly, it's been shown to kind of reduce kind of oxidative stress and delay kind of progression of some kidney diseases. I do think of it particularly in regards to IgA nephropathy. because often some of the allergic type responses will be driving some of the immunoglobulin production that kind of drives the disease. But also it can help in terms of intestinal barrier function, and kind of going back to that kind of gut microbiome where you're seeing often a lot of inflammatory metabolites being produced. Improving that kind of intestinal barrier can be really important in terms of preventing some of those metabolites from kind of reaching the kidneys.
And that's the way I love how you think as you do that formulating, because you're not going straight for a kidney herb. You really are thinking through the systems that precede everything that happens in the kidney and trying to, reinforce and strengthen and make sure that they're all working properly along the way. And it's such a robust way to build a formula.
Yeah, and definitely I think when you look at a lot of the traditional kind of evidence, a lot of the herbs that are kind of recommended are diuretics, and I really find that diuretics often don't have that much indication for a lot of the kidney presentations I see, and they can be kind of useful in some contexts. But possibly, just trying to drive through more fluid through the kidneys isn't necessarily going to be improving function, and particularly where there's kind of like reduced urine output, that can sometimes be problematic. Also, some of the diuretic herbs tend to have higher kind of potassium content, which can be issue with kind of like late stage kidney disease where you're seeing hyperkalemia. In terms of other herbs, licorice is one that I probably don't use a lot, but sometimes I do. It's something that can possibly drive up blood pressure, but there is a research study that looked at using licorice for kind of like reducing potassium levels in dialysis patients, and that didn't find the raised kind of like blood pressure in that set of patients. Going back to things like saunas, sauna is very effective for kind of clearing potassium via the skin as well. Often, if you've got patients with hyperkalemia, that may not resolve unless they're actually having a transplant. So definitely I prefer to use saunas in that context, because also the saunas have a range of other benefits as well. I think the other herbs that I'm very cautious of is any kind of like antimicrobial, particularly if you come in to treat dysbiosis, particularly where there's a high kind of inflammatory load coming from the gut, possibly kind of driving a die-off response initially is going to drive up inflammation, and particularly for patients with fairly low kidney function, they're not going to be able to clear that effectively, and it's not something that I generally would kind of like come in as a starting point. Often kind of look at some of those more balancing microbiome herbs like pomegranate, oak bark, and also kind of like really start very low dose with those types of approaches as well.
Yeah, that makes a lot of sense. I was going to actually ask you, I'm sure you do see complications arise as you travel this journey of healing with your patients. Do infections often come up?
I do see patients, like I've had patients on peritoneal dialysis where they've got peritonitis, which is really common, and they've kind of like detected resistant forms of bacteria that aren't responding fully to antibiotics. So we've used antimicrobial herbs in that context. That's something that, particularly when patients on dialysis, they're going to have better clearance of kind of herbs and other products. So probably less cautious around patients on dialysis than patients that are pre-dialysis.
And I heard you mention a bit earlier about looking after endothelial health and circulation. You mentioned the microcirculation as well. Is that something that you're doing regularly? What are your herbs that you're doing to support that endothelial function and that capillary health?
So definitely, like I mentioned, like ginkgo is a good one that I use a lot of. Looking at things that help, like in terms of particularly things like Japanese knotweed, green tea as well. Often kind of use those types of herbs. Things like beetroot can be quite helpful for supporting nitric oxide production. But yeah, I definitely think green tea is particularly helpful because it also has kind of anti-inflammatory and liver supporting effects, as well as having a kind of like gentle modulatory effect on the gut microbiome. And there's also kind of research that kind of like shows has anti-inflammatory effects on the kidneys as well.
It really is a whole complex system, isn't it? You're really looking at so many aspects when we're supporting these. I always look at the kidneys as being so delicate, and maybe that's incorrect, but there is just so much involved in making sure that they can do their job properly along the way. And you have mentioned your patients that maybe go on to dialysis, that are maybe waiting for transplant or post-transplant. This obviously becomes a very delicate area once we move into this area. Where do you stand with naturopathic and herbal support once we're in that zone and that phase of kidney disease?
Yeah, so you definitely need to understand that the kind of like presentation changes kind of like dramatically once someone starts on dialysis, but there's a lot of kind of applications for naturopathy in that context, particularly looking at really kind of like ongoing kind of gut and bowel support, because you're going to be still kind of like able to clear excess urea that's not being cleared by dialysis, and particularly between sessions via the bowel. And again, kind of coming back to that research body that shows that patients have worse outcomes on dialysis if they're if they've got constipations. Really just looking at gut health can be really helpful in that context. But then also it's really common to see things like fatigue occurring with kind of like dialysis, and that can be kind of like related to anemia, and often with hemoglobin levels, they're normally like lower than normal for dialysis patients. They're normally on erythropoietin medications, and the nephrologists are generally aiming for a hemoglobin level of around about 110. So often with that level, you're seeing kind of fatigue rise. I think in that context, there's a lot of indication just for general kind of adaptogen herbs, and also like immune modulatory herbs, and particularly some of the adaptogenic herbs from Chinese medicine have a very good safety profile in that context as well. Also, there's like so much pressure on the heart and the cardiovascular system, and it's really common to see with dialysis patients to have kind of cardiovascular issues. So really looking at those herbs that can kind of support cardiovascular system can be really helpful as well.
So I know that you've talked about preparing a patient for transplant. Do you then work with patients post-transplant? And if we were to have someone who had a kidney transplant come into our own clinics, what would be your advice on working with that patient?
I definitely see a lot of patients that are post-transplant, and particularly with the transplant medications, there's a lot of side effects associated with those. So often patients will be presenting to deal with some of those, but otherwise a lot of patients will want to just be getting a bit of a general kind of health guide of what they should be doing, kind of like post-transplant as well, because there's still not a lot to be supportive beyond just the actual kind of like transplant and meds. So I do find that nutrition plays a big role post-transplant. It will definitely look different to a pre-transplant diet, and there's various things that you cannot eat once you're on transplant medications that interact with the medications. But also the other consideration is also kind of herbal medicines. A lot of those will interact with medications, particularly tacrolimus. Tacrolimus is one of the most common immunosuppressants with kidney transplant, and it has a very narrow dosage window. So you'll find that too little of tacrolimus in your system can potentially cause organ rejection, or too much of it will potentially be nephrotoxic. And so there's a range of different herbs that can kind of like either slow or increase the metabolism of the drugs. You definitely need to be running it by the transplant team. Transplant team will be able to kind of like look at kind of interactions. I think looking at kind of nutritional medicine, vitamins, minerals, there's a lot more evidence for support. There is like some evidence for herbs with transplant drugs, particularly some kind of anti-inflammatory herbs will have been shown in kind of initial evidence to be reducing risk of rejection. But kind of at this stage, there's just not a level of evidence that really is supportive of kind of their use. So it's really something that I would be focusing more on trying to correct the system leading into transplant. I think there's a lot more that is useful in terms of using herbs in that context.
Yeah, absolutely. There's some very good research papers out there that actually show a lot of our drugs, not just kidney drugs and immune drugs, that do reduce our mineral and vitamin load significantly. And I think when we keep that afloat, people are going to feel quite good.
Yes.
I know in everything else we talked about with the kidney, you did talk about supporting those other systems around the kidney. Does that still hold true post-transplant?
Yeah, definitely. And in terms of particularly things like there's obviously with the transplant medications, there's an increased risk of cancer. There's an increased risk of kind of like diabetes due to blood sugar disturbances from the meds. These patients are on these medications long term until the kidney fails. So that kind of like risk increases over time. There's a lot you can do to kind of like negate those effects from a dietary standpoint, but also from nutritional medicine standpoint as well. And then even things like mood can often be kind of impacted due to the medications as well. So really, I think kind of coming back to those basic kind of foundations where we can kind of support various systems of the body, and particularly I think gut health plays a really important role, and there's a range of safe interventions with kind of like gut health, particularly like the benefit of the gut and the microbiome is it responds really well to food. So using some of those functional food approaches post-transplant can be really helpful for maintaining good gut microbiome, which can actually kind of extend the life of the transplanted organ as well.
That's great advice. That's helping us take care. And it's I imagine even once you've had a transplant and life obviously improves, but it's a lifetime long care situation.
Yeah, a transplanted kidney has a life expectancy of about 10 to 20 years, and it can be longer if people have looked after their health, but generally it will kind of like lose function at some point. And that's another, I guess, subset of patients I see is patients that have been on transplant for, 10, 20 years, and they're kind of going back into organ failure. And so we're doing things to try and kind of like delay that further as well. But it's definitely something that patients will have better kind of organ outcomes if they're really supporting their health in the long term. And again, that comes back to those kind of like foundational areas that we're really good at supporting. And it's really just a matter of being extremely cautious when you're kind of using any supplements. Just at the moment, there's such a lack of evidence. It would be great if we could kind of build evidence in that area, but it's something that, is probably unlikely in the near future, that's for sure.
Yes, it's a risky ethics situation to be in, isn't it? To be doing that kind of research. It really is complex. You're spinning a lot of plates as you support these patients. I'm in awe of the thought process that's going on behind it. I really am. Look, the other thing I guess I wanted to know for me personally as a practitioner, but I'm sure that our audience will as well, is just I know you are going on such a journey with patients with this. You're obviously seeing them sometimes at their lowest, you're seeing them, they're most scared, they're most afraid, changes can happen rapidly. How do you maybe manage for yourself and also for them just the emotional, the spiritual, the well-being aspect of working with someone who's looking at late-stage kidney disease?
Yeah, look, the issue for patients with late-stage kidney disease is often they're not diagnosed until they've got that late-stage kidney disease. So it comes as a real shock that they're having kidney failure and that they're going to have this life-changing kind of treatment, that kind of like means that they can't kind of carry on their life, as per usual. And so a lot of the time I'm seeing patients in shock. They're often looking for a miracle to avoid dialysis, which generally isn't possible. There's definitely some patients you can support avoid dialysis, and the problem is often they're coming to you at the very last moment before they need to kind of like start. So that can be quite challenging. And so there's a lot of emotional support that needs to kind of like go to the patient as well. I do find that because I've been through the various stages of kidney disease myself, that definitely helps in terms of patients being able to know that you understand where they're at, and particularly in terms of the medical side of support, patients are often diagnosed and then they're not offered any other type of allied health support. They may possibly see a dietitian, but I really think that patients, particularly diagnosed with late-stage kidney disease, should be kind of referred on to psychologists as well, because it's such a big emotional strain, and particularly with patients that, you know, have a lot of may have children or other financial commitments, having to consider the idea of not being able to go to work 3 days a week can be really kind of life altering.
Yes. And I imagine there's that onflow to partners, to parents, to siblings, to children, to work colleagues. It's a huge life change, isn't it? It's a big thing to navigate. And I would imagine that your experience and that connection that you can draw really gives solace to many of your patients.
Yes, definitely. Once they actually, speaking to someone that's kind of been through the process themselves and has an understanding, it makes a big difference, because I think the problem with nephrologists is they haven't had kidney failure themselves, most of them, I'd say. And so they have a bit of an altered perception of what it's actually like. And I've had various nephrologists over the years say some very odd things to patients about how they assume they should be feeling. But it's really something that, unless you've gone through that, you really have no idea of really how much it can kind of impact you on so many various levels of health.
Yeah, there's a lot of loss and grief in there, isn't it? Well, or you're also trying to bolster your own resilience and strength to face and work with what you've been challenged with as well.
Yeah, exactly. Particularly with dialysis, patients starting on dialysis, it's often not easy on the body. The body has some time to adjust to the treatment. It's really common to see a lot of side effects initially with it. And so it can be a fairly scary thing for patients to start, because it's got these all these complications often that often get smoothed out over the months of starting it. But yeah, a lot of the time patients are told that they'll need to start dialysis, they'll feel better on dialysis, but yeah, often they don't feel better. And I think that's also where we can potentially come in and really assist, because there's some really simple approaches that can make things better, and particularly getting the diet right in dialysis makes improvement in terms of patient wellbeing as well.
Yes. Yeah. And we know that is what we have the beauty to do with natural medicine is, you know, sometimes even while bigger treatments and medical interventions are happening, we can reduce side effects. We can just get someone's a little bit of energy back, reduce that brain fog a little bit. And that can really make a big difference in giving them that strength to carry on and do what they need to do.
Yes. And particularly for patients that are doing a workup or waiting for transplant, there's so much that we can do during that period as well. So essentially prepping patients for transplant, I think, can be really helpful from a naturopathic perspective, particularly just trying to support the gut, because there's definitely a lot of research that shows that dysbiosis can potentially drive organ rejection as well, but also just working on kind of inflammatory parameters. Also, sometimes just getting things like the diet right and the patient stable on dialysis means that they can get listed on the transplant list as well. Problem with dialysis is it's a pretty standard one approach. So a lot of patients that don't initially do well, there may not be a lot of adjustment to treatment for those patients from the dialysis team. So being able to step in and do what we do, I think, can be quite important as well.
Yeah, lots of support that we can give along the way. Oh, Adrian, we need you lecturing in our major hospitals, in major cities. They could just get you in for a day and pick up a little bit of how else they can support people. Wouldn't it be amazing to outcome get if we all work together? Now, I guess to sort of wrap up today, and you've just imparted so much wisdom with us, but What would you like us to know? For us practitioners who are out there, maybe we specialise in something else, maybe we're having more of a general practice in our naturopathic consults. What would you really like us to maybe look out for in pathology testing or functional testing? What would you really want us to know about just being aware of our patients' kidney function and overall well-being?
Look, I think really any patient, particularly with a metabolic health condition, should be being kind of monitored for kidney function as well. So particularly looking at kind of EGFR and creatinine and urea levels, they can often start to kind of like drift out a bit. So it's really something that I'd be, screening kind of like at least annually. Also, urinary albumin can be quite helpful to be doing periodically because it's quite common to see normal kidney function, but you're seeing protein loss in the urine. They're probably there's a range of other kind of like markers you can potentially do, but just starting with those types of screens. And also if you are seeing a decline in GFR or increasing creatinine, looking at further investigation. Like it's really common for patients that have like a decline in EGFR, and their GP won't actually do anything about it. Generally, it's not classified as kidney disease until you're under a GFR of 60. So that may be the time they start to refer. But I think if you're even seeing, GFR drop below kind of like 90, particularly over multiple tests, because you will find that sometimes GFR can just waver around based on various factors. But if you're starting to see that trajectory kind of like going down with GFR, I'd be kind of worrying that, particularly at the early stages, because there's so much you can do to correct that. And really not kind of like just relying that they're having medical follow-up, because I have had patients that have come to see me where their GP didn't refer them to a nephrologist until they were under a GFR of 30.
How much kidney function's lost? Like if you're at that point, and that's only when your GP's picking it up, I'm assuming your kidneys are really struggling and the function's not great at that point.
Yeah, so you've generally lost a majority of function at that point, and there'll be a lot of nephrons that'll be kind of like left that are overcompensating for the major loss of nephrons. It's really common not to have any symptoms at that stage. I've got patients that I see who are kind of like still asymptomatic with a GFR of 10, so you can't rely on symptoms at all. Definitely, if you're seeing the symptoms, it's an indication, but yeah, definitely if the patient is asymptomatic, you still need to kind of explore that with kind of like pathology. I think like electrolytes are really good to keep an eye on as well. Particularly, there's kind of like research around bicarbonate that shows that if you can kind of maintain bicarbonate levels above 22, that can slow the decline, and you can often see bicarbonate kind of like dropping below that, particularly in the later stages, but also just early stages, kind of like electrolytes and being able to calculate anion gap to really just monitor the kind of acid base load in the body is really helpful as well.
So lots we can just be aware of, and
yes.
And I think just that it is being aware of the kidney as a part of the system, and when I opened, I sort of said, I know that we're very good at livers and we're very good at detoxing and we're very good at adrenals and guts and all of the rest of it. And the conversation isn't always around kidney. And I'm so glad that we've shared this time today. And you've been so generous with your knowledge and your experience, because I really would love us as a profession to include kidney and kidney concern and kidney awareness in what we're doing. So, yeah. Anything else you'd like to leave us with?
I think like the really kind of important thing for practitioners is to really understand that there's such a range of different kidney diseases, and they'll all have like different underlying kind of drivers. And so it's really important to not be treating kind of kidney disease as one condition. We need to kind of get back to that kind of naturopathic mindset of what the underlying cause is. Particularly, I see patients that have diagnosed kidney disease, but the nephrologist is unable to identify what the actual kind of like cause of kidney disease is. So it's just this general kidney disease. And I think that's when we can kind of come back to kind of foundations around things like gut health, inflammation, circulation, and also look at some of those other functional investigations that we have on hand, particularly to rule out any kind of environmental factors as well. And then also really being kind of like guided by what the patient's pathology is doing as well, particularly just understanding that like protein levels really vary depending on what stage of kidney function you're on and if you're on kind of dialysis or not. So it really needs to be like an individualized approach. That's something that, you know, we should be always doing as a naturopath anyway, but I think it's something that is often kind of like overlooked with kidney disease. So really, if we can get back to that basic kind of foundation, then it should kind of like serve us well.
I think that is very good advice, very steady, safe, and holistic advice, and that's what we want to do. We're looking after that whole person in front of us, aren't we, at all times?
Yeah, exactly.
Adrian, it's been so lovely to chat with you today. Thank you for being here with us at the Herbal Extract Company and for sharing your wisdom. I'm so pleased that you've been able to share all of this knowledge and that our practitioners have been able to hear what you get up to in clinic and the magic that you are working there. And I'm sure your patients appreciate it no end. So thank you so much for being on board.
Thanks, Lara. It was really great to be able to come and speak to you today.
Take care, Adrian. Thank you.
Thanks.